Hi everyone, I'm Dr. Lynn Wagner and you are listening to The Wealthy Life. Today's episode is all about hair loss. I can't tell you how many patients I see who struggle with hair loss. And it's important to understand the how and the why of why the hair loss is happening, because I also see patients randomly going online, going to supplement stores, buying devices on the internet, all marketed at them to stop their hair loss, but there's so many different reasons why hair loss happens that you have to understand why it's happening so you know how to treat it. So that's what this video is all about. And even if you're someone who is not having hair loss, you want to prevent it from happening. So hair loss can happen at all stages of life, and the more you know about it and the more you take care of your scalp and your hair and your body from the inside out, the less likely you are to suffer from hair loss in the future. So let's talk about the common causes of hair loss first. The most common cause of hair loss is genetic. So there's male and female patterned hair loss, and that happens because of a hormone called DHT, which is derived or comes from testosterone. Some people are more sensitive to DHT, and DHT directly causes hair loss. And DHT isn't a bad hormone, but for some, it's not great for their hair, and too much is never a good idea. Another common cause of hair loss is going to be stress. So whether you have like an insanely intense, stressful incident in your life, or you have chronic daily stress, that stress is going to lead to a rise in your cortisol levels, which is going to shift your body into survival mode. And when you're in survival mode, your body is going to push the hair follicles into resting phase, and it will lead to shedding. So stress is a really big cause of hair loss. Another one we see all the time at Wagner Integrative Health is rapid weight loss. So especially with the surge in weight loss medications, people are losing weight too fast. And when you lose weight too fast, it puts your body into stress mode. So it's the same as what I talked about with stress causing hair loss. Rapid weight loss causes stress, which causes hair loss. And the other thing that people don't know about is when you lose weight really fast, your fat cells store your toxins. We all have a toxic burden in our body. And when you're losing weight, if you lose fat cells too quickly, those toxins get mobilized into your bloodstream, and then they have to be filtered out of your body somehow, either your liver or your kidneys or your stool. And if you have too much of a toxic burden in your body, your organs can't keep up, and those toxins sit in your body, and that's going to cause inflammation and oxidative stress, which will then cause hair loss. So rapid weight loss is a no-no. Another common thing that we see is hypothyroidism. So whether you have or hypothyroidism, high or low thyroid, that will cause hair loss. Rapid hormone changes can cause hair loss. So we all know of women who have a shedding period after they deliver a baby. We always hear women going into menopause who complain of their ponytail getting thinner. Big hormone changes are a big driver of hair loss. And then nutrient deficiencies is another obvious one. So the most common one we see at Wagner Integrative Health is actually a deficiency in iron or ferritin, which is really common in women. It's cool when we have them come in, we check their labs, we find that they're low in ferritin, we replace it with a supplement, and within 3 to 6 months, they're growing their hair back and they have all these fine baby hairs growing in and they're really happy. So nutrient deficiencies can definitely cause it. And it's not just iron and ferritin, there are other ones as well, but that's the biggest one that I see. And similarly, if you have poor nutrition, you're not only going to have nutrient deficiencies, but you're not going to have enough of that healthy protein and fat and all those things that you need to nourish your hair follicles. Things that are less common that we see but can definitely cause hair loss, and you should definitely think about, are things like heavy metals. So things like mercury or lead, which are also easily tested, can cause hair loss. Certain medications can cause hair loss. So if you're on a prescription medication and you're suffering from hair loss, you always want to look at the side effects and adverse effects of that medication and see if that's what's causing it. And then if you can switch to a different medication, great. Or if you can't, at least you know why it's happening. Excessive androgen exposure. So I talked about that hormone DHT. DHT is an androgen. So androgens are testosterone and DHT. So if you're someone who's on testosterone as a medication, which is also very common, you want to have someone who's monitoring your DHT levels or monitors you for hair loss, because if you're genetically at risk for losing hair from too much DHT, they're going to want to be careful with putting you on testosterone or put you on a medication that helps block that conversion to DHT, or even take something like saw palmetto, which just does the same thing. So there's lots of things you can do, but it's important to know, important to work with someone who knows what they're doing. A couple other things we see is infections can cause hair loss. So during COVID, it was really, really common that people would come in several months after they had COVID and they had just a huge shedding of hair. The good thing about those incidences is it does come back, but it's not fun when it's happening. And then one thing that I love to treat is when there's fungal overgrowth on the scalp. So if people have ringworm on their scalp, they'll have patchy hair loss. That's easy to treat. You can even have candida overgrowth on your scalp, which is hard to diagnose, but we'll often just put people on like a ketoconazole strong shampoo a couple times a week, just assuming that maybe they have some fungal overgrowth, and that will lead to an improvement in the growth of their hair. I'm going to wrap up by talking about your hair's structure and its support system, because hair isn't just the shaft that you see on the outside. This part is actually dead. There's no nerves, there's no blood vessels. That's why when you cut your hair, it doesn't hurt, because it's already dead. So once it's out of your scalp, you can obviously use products to keep it healthy, but you're not going to be doing anything from the inside out to help grow healthy hair. So the hair starts with actually little capillaries. So capillaries are little blood vessels, and they bring blood flow to the root of your hair. So it's going to bring oxygen and nutrients. So if you're eating a healthy diet, but you don't have good blood flow to your scalp, you're missing out. So you want to have healthy blood flow to the scalp through those capillaries. And then those capillaries are reaching the root and the follicle of your hair. So the follicle is like a little pouch, and then the root of the hair sits in that, and then it grows into the shaft outside of your scalp. So as that oxygen and nutrients are coming towards the hair, they're going directly towards that follicle, which is then feeding the root of your hair, and the hair is growing. Along the follicle of your hair, you also have these little sebaceous glands, and they secrete something called sebum, which is what gives your hair that lustrous, soft glow. So if you have a lack of those glands, you're not going to have that soft, shiny hair that a lot of us would like to have. And then you also have to just think about the scalp in general. So the scalp is kind of like the soil of your hair. So if you think about the scalp, you want it to be healthy and have good blood flow. You don't want it to be plugged. You don't want it to have fungal overgrowth. So you have to think of the scalp. All those are very important parts of the structure of your hair to think about. So with that being said, I hope that helped you understand what hair is all about and why it might fall out, so that you can make an educated decision to buy a product or see someone like us to help you regrow your hair, and you can start incorporating things in your lifestyle to prevent it from falling out in the future. So next we will talk about the different treatments for hair loss, which will be the exciting one, so that you can decide what things you can incorporate into your routine that aren't too hard, that will help you keep beautiful, healthy hair, or help you regrow it if you're someone experiencing hair loss.